Hello everyone, I am Dr. Vijaymahantesh. I am consultant pediatric surgeon and pediatric urologist. I am working at Indian Hospital and Heart Institute, Mangaluru. So I am a specialist dealing with conditions in children, surgical condition especially. So today we will be discussing something about one of those conditions, which we call it as hypospadias. So this is a condition that occurs in the male babies and it is present since birth. So as we all know, the urinary opening on the penis and the penile shaft of the baby opens at the tip. But in this condition called as hypospadias, the opening occurs on the undersurface. That is, if it is a tip, it occurs on the undersurface of the penis. Needless to say, all these conditions require a surgical intervention. It is not just the opening that is underneath, there is also a bend in the penis. Rather than penis being straight, it will be a bent structure. So this needs to be corrected. The usual age at which this correction begins is between 6 months to 9 months of age and can be completed by around 1 to 2 years. The idea of starting the correction early and completing the correction early is that the child should be able to go to school, or when he meets his peers at school, he should be able to stand up and pass urine like other normal children do. There are certain myths concerning this hypospadias. One of the commonest myths is that this is not a life-threatening condition, so it need not be corrected early. So it's true that it is not a life-threatening condition, but waiting until the child grows to adolescence or adulthood is not correct. So many of these children, they develop peer pressure or they develop insecurity about their genital organs. So this has to be corrected by the time the child becomes aware of his genitalia. The ideal time for correction is between 9 months. And we can complete, if the requirement is in staged procedure, we can complete it by around 1.5 to 2 years of age. Now there is second myth that almost all these corrections are going to fail. That is not true. Once it is operated by a trained pediatric urologist who has had good experience in treating such conditions, the results can be pretty good. Though in certain situations we may have to operate in more than one stage, but yes, we can give good care for these children. So if we have any patients suffering from hypospadias or having such conditions, do not hesitate and come and meet us immediately whenever you feel so. Thank you.
Indiana Hospital and Heart Institute. Aid. Inspire. Aspire.